because I think it's so relevant right now. And not only with the holidays coming, but with what I'm going to call kind of the trifecta of stress that I think is going on for caregivers right now. And I had this thought as I was putting the slides together. I kept having this image of close to a year ago, all the fire engines that would come outside of our hospital and clap for all of the healthcare workers. And it was just this kind of amazing and beautiful thing. And I kept thinking, I wish that we could do that for all of you, because I think that you are providing this very, very amazing and necessary service to your loved ones and to the patients you care for. And unfortunately, it's often in the privacy of your own homes or in settings where fire trucks can't get to and clap for you. And so I wanted to just start out by thanking you for all the work that you do, because I know that it's hard work. And I hope this conversation today will give you some strategies to help you along the way. So as I mentioned before, I think this is particularly relevant because we have these three sources of major stress, and these three things happening all at once that we have lots of research on that we know have a major impact on mental health. And one is caregiving. We've seen an enormous amount of literature, thankfully now, talking about things like caregiver stress and burden and burnout. And we know that caregiving takes a huge toll on many people. We are living in a pandemic, and all the uncertainties and change and craziness that creates. And we are now seeing a boom in articles and news stories and literature on the impact on mental health that is taking. And the holidays, which I don't want to turn completely sour, because certainly there's many joyous aspects of holidays, but there is this phenomenon of holiday blues that I think we're all pretty familiar with. And at the very least, holidays certainly create stress. And so we have this kind of perfect storm for many of you who are tuning into this conversation of having to deal with all three of these things at once right now. So just to present a little bit of the research on the impact that these three things actually have on mental health. I mentioned before this boom in research around caregiver burden and the toll that caregiving takes. We're seeing rates as high as 50% of primary caregivers of patients with Alzheimer's disease reporting significant psychiatric symptoms that require formal treatment. That's a huge number, 50%. And what we're also seeing is this phenomenon that those caregivers that are experiencing that stress, depression, anxiety, it is wearing away at their quality of life. And unfortunately, as their quality of life declines, so too often does the quality of care that they're able to provide for the patients. And so we enter into this vicious cycle where if the care goes down and the patient becomes more sick or has higher need, then that places more of a burden, and then you kind of get into that vicious cycle. So we certainly could understand how that takes an enormous toll on mental health. The impact of COVID. I came across this interesting research in preparing for this that spoke to some of the phenomenon that we see in disaster. And the reactions, the mental health reactions to disaster. And I know this chart at the very bottom of the slide is pretty tiny, and I won't go in depth into the whole thing, but basically what it speaks to is we see through a lot of data collection that there tends to be a trend in reactions to disaster, and certainly COVID would be considered a major disaster, where people go through phases where there's the anticipation of the disaster, and then there's the impact, that kind of shock wave that hits. And then we have this kind of this tendency towards this heroicism. I mentioned the fire trucks outside of the hospitals and kind of this, this beautiful presentation of human nature and people coming together. And then there's even this kind of honeymoon phase where it's not a honeymoon because it's all wonderful, but where we kind of settle in, we kind of let go of the shock value, and we start adapting to a lot of the changes that have happened because of the disaster. But then close to around a year after, which we are very much in this period, we get to this place of disillusionment where there is this feeling of fatigue, of having to continually adapt, of not having a clear end point. There is higher rates of depression, higher rates of anxiety. We just kind of get sick of it. And the good news is that we do see people getting to a place of reconstruction where things begin to get better. But right now we are very much in that place of disillusionment. And so in terms of adding to the trifecta, add that to the equation too. But some of the research we're seeing is that rates of depression have increased threefold since the start of the pandemic. Again, huge numbers. About 2 out of 5 adults are reporting significant psychiatric symptoms of anxiety, depression, PTSD, increases in substance abuse. And unfortunately, when we look at that data, there seem to be particularly vulnerable populations, and you guys are one of them, unpaid caregivers for adults. Certainly, even I imagine paid caregivers, because essential workers would be in that grouping. And for those of you who might be in more than one of these categories at the same time, again, kind of just adds to that perfect storm phenomenon. And then the impact of the holidays. There is some mixed research about the concept of the holiday blues, and there has been this perception that the holidays are the highest time for things like suicide, and it's not absolutely the truth, but what the data does show is that there is this dyad of both joy and stress happening around the holidays. And even joy can be stressful, right? Having to get gifts, having to spend the money, having to figure out plans, especially right now. What will those plans look like? How will we modify things? How will we, and I know Dr. Gieniusz is going to talk a bit about that, but it is really stressful. In California, they did a study and they found that about 62% of people reported that around the holidays, their stress increases tremendously. And people before the holiday time, as the previous slide mentioned, were already reporting heightened rates of depression, anxiety. And so now if on top of that, the stress increases, then again, we have that trifecta effect. In looking through the research that I had just presented, people give some subjective particular experiences of, I'm using the term stress very generally, but, what does that actually mean? What is it actually affecting? And we see that across the board, the effects are fairly similar between holiday time, the impact of COVID, and the impact of caregiving. That is, from a physical standpoint, it takes a huge toll. Sleep goes down the drain. It's one of the first things to tend to go down the drain. People are having this departure from self-care routines, from exercise that may have been keeping them afloat. They're not able to engage in that. We have lowered immune system functioning because of that heightened stress, and particularly now that puts you at greater risk. And just a decrease in self-awareness, which we've also seen where a person might get so focused on caring for another person or so focused on trying to mitigate the risk of COVID that they're not tuning into their bodies, and they might not be attending their annual physical. They might not be going to their annual mammogram. And so we see the effect of these things. In terms of emotional effect, fear, anger, sadness, grief. We've had tons of loss around this time and the anticipation of grief. And we know that holidays tend to bring up loss. And so again, that gets magnified. Guilt, feeling just completely overwhelmed, feeling hopeless, that disillusionment phase. And often feelings of inadequacy come up. People kind of feel like, I'm not doing a good job in any one of these things right now. And the social impact, I think the big one that we've heard this term used a lot, certainly all of these are significant, but I think the big term is isolation. Both actual isolation and not being able to see our loved ones, not being able to see friends, not being able to access the support. Perhaps the aid that used to help in caring for your loved one is no longer able to come in. The adult daycare center is no longer open. So actually being physically isolated from the supports. But then there's also the perception of isolation, feeling like you're the only one suffering to this extent. You're the only one dealing with all these problems. And those two things can really take a toll on our emotional well-being. So I assure you, I will not leave this as doom and gloom. This was all the bad news. The good news is that there are some things that we can do to take better care of ourselves and to try to mitigate this trifecta that's going on right now. And the two kind of overarching concepts that are crucial when thinking about self-care, one is the serenity prayer, which I very much so love. And as much as it mentions God, I think of it as not necessarily a religious thing, but more just kind of a way of existing. And that is, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. There absolutely right now are many things we cannot control. We cannot control when the vaccinations will come and when we will get to that reconstruction period. We cannot control the way the disease is going to affect the person we're caring for and how the degeneration will happen or how they might behave in one given moment. But there are things that we can control. We can control the way we think about things. We can control the perspective we choose to take. We can control the priorities we have in our lives, the flexibility with which we want to approach things. And we'll delve a little bit more into that in the next slide. The other kind of overarching concept that's so crucial with self-care is this metaphor that maybe some of you are familiar with. This is taken from the flight safety book that's in almost every plane. And it shows you a picture of an adult and a child grabbing the oxygen masks. And it specifically gives the instructions that the adult has to put the mask on themselves before putting the mask on their child. If you're a parent, this feels very wrong and feels completely counterintuitive, but it is intuitive. Because if you do not care for yourself, if you lose oxygen, then that child who's completely dependent on you is not going to get cared for. So it is crucial that we take this time to care for ourselves. How do we do it? How do we take care of ourselves? I'm sure many of you have seen lists like this on caregiver websites and things like that. I hope you have. And I know sometimes it could feel like I'm overwhelmed. You just acknowledge that I'm overwhelmed and now you're giving me more things to do. But these are all relative, meaning little baby steps in any one of these areas can make a big difference. And also think of these as the tools that are going to make the rest of the things easier to cope with, right? So exercise. If you haven't exercised in a year, start with stretching. Start with just walking for 5 minutes. Getting some fresh air. We know that getting outside for a little bit every day makes a big difference in well-being. Nutrition is not the easiest thing to focus on in the holidays, and we know that this is a particularly good time for emotional eating, but when you can, make a choice for fresh over processed. When you can, make a choice for the wholesome foods as opposed to the sugary foods. Alcohol is a big temptation right now, and I know I had mentioned in that slide around the data of the impact of COVID, we're seeing big increases in substance abuse. Try to fight that temptation or do it in moderation. It is not a good combination to have this high level of stress and then bring alcohol into the equation. Prioritizing sleep, as I mentioned before, it's one of the first things to fall down the drain, but it is one of the most important things for both physical and mental well-being. So even if you're just trying to set a specific sleep time and wake time and holding to that, that can make a big difference. Trying to incorporate some pleasure into your day and socialization, whether it's virtually or in person, trying to bring that into life. Ask for help. I know that help is not as easy to come by as it had been prior to the pandemic, but it is still there. Don't be afraid to ask for help or to delegate certain tasks, particularly for holiday get-togethers or any kind of traditions that you're trying to maintain. And boundaries, 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 boundaries. I know it feels awful sometimes and you feel like you're being rigid, but boundaries are often the kind of fabric that allows us to be flexible. It creates that foundation. And so establishing some boundaries with the person you're caring for, with other family members, with friends, with yourself, not, doing something beyond a certain point. And particularly in the current times, what we're noticing is people are having this kind of flooding experience of news and social media and information. And while it's important to stay informed at a time like this, there is such a thing as too much. And so you want to really be cautious. Limit how much you're watching the news or taking in the news. Limit how much you're scrolling on your phone or tuning into social media. Some connection is good, some information, too much is a bad thing. We also can shift our mindset in terms of self-care. I love this little cartoon I found, which is, you wouldn't let this happen to your phone, don't let it happen to you either, right? And I remember one person, when I was talking about caregiver stress, said the difference between us and a battery is that when a battery dies, that's it. It's not going to function anymore. Whereas people, we get to empty and we just keep going and keep going and keep going and keep going, and we get ourselves sick, right? And so one of the ways you can recharge your battery is not only by shifting your behavior, but really shifting your mindset. This whole slide presentation, if you take nothing from it but the notion that to feel completely overwhelmed and stressed is normal, can be a helpful step in shifting mindset. Rather than punishing yourself or feeling ashamed for the struggle you're having, normalize it. Recognize so many other people feel this way right now. Try to shift from what you can't control, like, I don't know when this is going to happen, I don't know when this is going to happen, to focusing on what can I control. Today I can focus on this. Today I can spend a little bit of time with my loved one and enjoy something nice. If you're somebody who tends to be in that black and white mode, like, if we can't do the holidays like we used to, then I'm not going to do it at all. I had a patient the other day say, forget it, I'm not doing a tree. If I can't have my family over and I can have the big party, I'm not putting my tree up. And my homework for her was, get out that tree, put up the tree. If it's just that you do, it could make you feel different, give you a sense of accomplishment, and give you a little bit of that feeling of holidays. Big one is shifting expectations. And I think Dr. Gieniusz will talk about this too, but shifting what the norm is, shifting our sense of what can feel festive, what can feel pleasurable, what can be enjoyable, what can be meaningful, can really help us mitigate that impact on our mental health. And gratitude is always something that sometimes feels hard to find, and it might take a conscious intention to find it, but taking time each day to find something that you feel grateful for, even in the midst of all this stress, can be helpful. And the last part is shifting our feelings, which doesn't happen so easily. And the first way to kind of work with our feelings is to really just give ourselves permission to have them. You need to cry, cry. You need to scream, scream. You need to, punch a pillow, punch a pillow. You're allowed to be angry and sad and frustrated and confused. Let yourself have the emotions. And chances are, if you let yourself, somebody else might also let themselves, and then you could have that joint experience. If the worry around this time or the stress becomes so overwhelming, this concept of a designated worry time can be helpful. So you do allow for the feelings, but you kind of put some boundaries on it. You say, every day at around 6:30, I'm going to give myself 15 minutes to freak out. And in those 15 minutes, I might scream. I might write down all the things that stress me. I might just, get angry. But I'm going to put an alarm on. And when that alarm rings, I'm going to shift away from that and go back to the rest of my day. And if other worries or stresses come up, I'll remind myself tomorrow at 6, I'll be able to do this all over again. Meditation, relaxation, crucial for well-being. I was really happy to see that in the midst of the pandemic, apps like Calm and Headspace have really been being highly utilized. But you don't have to download an app, and you don't have to do a relaxation exercise for 45 minutes to get benefit. Sometimes just finding little moments in the day to be grounded in the here and now, to be present, and to bring intention to what you're doing can make the difference of feeling like you're just increasing stress upon stress upon stress versus allowing it to dissipate. I don't know if we're going to have time at the end of this. If we do, I can take you through an exercise. If we run out of time, if there's a forum that I could share some of these tools with you guys, I'd be happy to. The last point that I think is really crucial to make is that while all of these feelings are normal, And all these stresses and struggles and points of suffering are very normative. If you feel like your stress or your suffering is getting to a place where it is interfering with your functioning, then it is crucial to get professional help, and it is available. Thankfully, right now, more available than typical because we have these virtual settings where more providers can provide care. So do not hesitate. If in doubt, I'd always rather err on the side of getting the support you might need than trying to just manage it by yourself. Am I out of time to do the exercise? I think so, right?
Why don't we come back at the end, Dr. Gittleman?
Perfect. Okay, great. Okay. Thank you so much.
Thank you, Dr. Gittleman. That was very, very insightful and timely. Very appreciated. Next up, we'd like to transition over to Dr. Marzena Gieniusz. Dr. Marzena Gieniusz is an internist and a geriatrician at the Division of Geriatrics and Palliative Medicine at Northwell Health. She's also an assistant professor at the Zucker School of Medicine at Hofstra and medical director of the Alzheimer's and Dementia. Specializes in the care of older adults with a clinical focus on dementia care, advanced and complex illness management, and preventative care. Dr. Gieniusz, thank you for being with us, and feel free to take control.
Thank you so much, Kelly, and thank you, Dr. Gittleman. That was, I think, super insightful. I agree, and I think you mentioned some excellent points that I hope to build on in my part of the talk, and maybe expand a little bit more in some other areas. So in my talk, we'll review some do's and don'ts for enjoying the holidays. We'll also discuss some holiday safety precautions. And of course, in the age of, and the time of COVID, how can we not discuss some COVID-19 consideration? So as Dr. Gittleman mentioned, holidays often are associated with all the wonderful things like family and fun and traditions, but can also bring about some increased obligations, visits from extended family, and other stressors, including financial stressors, time constraints, and so forth. All of these things can cause worsening confusion and anxiety, not only for the patients or person with dementia, but also for the family and the loved ones who are involved. So some of the do's and recommendations are to maintain routines as much as possible. So if your loved one has a routine for waking up at a certain time and having their breakfast and maybe having a bedtime routine, or going to bed at a certain time, or doing other things throughout the day, going for a walk and so forth, try to maintain as much of the routine as possible. It will help to maintain a sense of things are okay and just like any other day, which is often helpful. Keeping things simple and casual also may be helpful. So for example, if perhaps you're used to kind of having a big extravagant dinner, but maybe this year that seems a little bit overwhelming, or maybe it's not so appropriate, consider doing a smaller dinner, maybe having just a few dishes. Same thing with decorations. Decorations can be really fun and exciting. However, for patients with dementia, it can be a little bit too stimulating to have a lot of different decorations and a lot of change in their environment. So maybe just picking a few decorations to set the mood and enjoy the holiday time may be a little bit better. Avoiding strange places also is helpful for patients with dementia, because any new and unfamiliar, whether it's environment, things, or people, can be stressful and frustrating for patients with dementia. Some of the don'ts include, don't feel obligated to host parties in your home, or attend every single event that there is planned. So try to pick and choose which one would be most appropriate and which one you and your loved ones would enjoy. And again, don't feel obligated to make it to all of them. Know your limitations and know what your loved one as well as yourself can handle. Also, don't forget to rest. So sometimes when we're in the midst of planning and a lot of different events and traditions, we forget that getting rest, getting regular sleep is also very, very important. Just like Dr. Gittleman mentioned, recharging your battery. This way, you don't find yourself running on empty. So again, new and unfamiliar things, big crowds, bright lights, and loud noises can confuse and frustrate someone with dementia. So try to prioritize smaller, low-key gatherings. So perhaps if you're used to having a big family gathering on holidays, perhaps consider doing 1 or 2 smaller gatherings. It may be a little bit less overwhelming, less stimulating, and less frustrating overall. Having a quiet room for escape, if needed, may be a good option to have in case the environment or the situation or the gathering is a little bit overwhelming for the person with dementia. So having that kind of getaway spot to unwind, to relax, and to decrease the stimulation is often helpful for patients who have cognitive impairment or dementia. Certainly playing loud music or keeping lights too bright or too dim are some of the don'ts. And also don't forget to prepare quiet distractions. Again, if a person is overstimulated. And these can range from things like reviewing a family photo album to giving a hand massage, to watching a favorite movie, or just taking a walk, whether it's outside or even inside, away from where all the activity is in the gathering. People with dementia also benefit from engaging their senses and optimizing their sensory input. So even though perhaps persons with more advanced dementia may forget where they are, perhaps they may not realize what holiday it is, but they may actually still remember and enjoy familiar senses like taste and sights and sounds. So do try to make an effort to include familiar treats like peppermint or eggnog or latkes. Even though they may forget many other things, they may still remember the taste of these things and associate that with good memories. Playing favorite songs is another do. Again, they may not be able to remember the words, but somewhere in their mind, they enjoy the music and may even may even start to sing along. And that could be an enjoyable thing for people with dementia. Another do is lighting a menorah together. Maybe that's an activity that has been done traditionally for many years. And again, having that familiar activity to do and seeing the lights and going through that activity may be really enjoyable and for the person with dementia. One don't that I do want to mention is not forgetting sensory aids. So again, optimizing any sensory input is helpful for patients with dementia. So don't forget to put on the hearing aids. Don't forget to make sure they have their glasses on. all of maximizing their sensory input can really help them to enjoy, whether it's conversations with family or friends, or try to stay as much engaged in the interactions and activity during a gathering. Patients with dementia may have difficulty moving quickly from one activity to another. So remember that you don't necessarily have to celebrate and do everything all in one day. You can break things apart and do a little bit one day and perhaps leave some things for another day, or just, you know, cut some things out and really focus on a few things that you would find really enjoyable. And remember, it's not about how many things you do, but about the quality time that you spend together with your loved ones. So do focus on creating special memories, whether it's watching the kids get excited and open up their presents, or gathering everyone and looking through maybe photos, or listening to favorite music, or singing carols, or doing small, simple things sometimes can be more enjoyable than more kind of complicated and things that can be stressful. And try to involve your loved one with dementia as much as possible in the things that they can participate in, such as decorating, wrapping gifts, cooking, maybe baking cookies, or setting the table. So within their limitations and safety, obviously. And don't focus, again, on the quantity of activities or trying to kind of do everything and get everything done. And focus instead on the quality time spent together. And if any activity becomes too stressful, don't hesitate to discontinue and either reschedule or just end it and focus on doing something else. Again, as Dr. Gittleman mentioned, the holidays can be a very tough time, not only for caregivers, but for people with dementia. And that's for, you know, various reasons. Sometimes the holidays can be a time when we really miss the people that perhaps are not with us anymore, and we remember the times that we spent with those loved ones, and the traditions, and them being involved, and so that can be a little bit of a sore thing for people around the holidays, and can make things a little bit tough. So do consider joining a support group, not only to have an outlet to discuss perhaps your frustrations and challenges and difficulties, but also to hear from others, maybe some helpful tips, and often people end up kind of like Dr. Gittleman mentioned, instead of feeling like you're the only one going through a difficult time and everyone else seems to be doing well, you actually end up hearing that you're probably not alone. And there are a lot of other people going through very similar experiences. And sometimes hearing that and having that acknowledged that you're not the only one that feels like you're not doing things well is really helpful. And of course, prioritizing self-care, just like Dr. Gittleman mentioned again. So remembering to exercise, especially if you have that routine, try not to break that, eating healthy, spending time outside, even if it's just going for a short walk, getting some fresh air, seeing nature, trees, it really helps to reset and lower the stress level or anxiety or whatever you're going through. And rest, of course. So Even though there's a lot of things to be done around the holidays, there's a lot of cooking and cleaning and organizing and planning and so forth to do, remember that how important it is to rest and get adequate sleep. And don't hesitate to cancel or reschedule plans if you're feeling overwhelmed. So, you know, sometimes things change, right? Situations change, things come up. Don't feel pressured to, you know, move forward with a plan or a gathering if perhaps it seems like maybe that's not the best time. You can try to either reschedule for another time when things are a little bit more manageable, or just cancel if you feel like it's going to cause too much stress and you won't really be able to enjoy it. And again, don't neglect your personal needs. So if you need rest, you take the rest. If you need support, ask for help. You know, taking care of someone with dementia is not a simple thing, and it can be very demanding. So ask for help. Even if you want to perhaps attend a gathering that may not be the most appropriate for to bring your loved one with dementia, perhaps ask someone to stay with them while you go to the gathering yourself, if you wish to. So again, don't neglect your own personal wishes and needs. Person with dementia may not remember certain guests or past traditions. So often it's helpful to perhaps prepare visiting family or guests with what to expect. So sometimes around the holidays, we see people that perhaps we haven't seen in a couple of months or even years. So it may be helpful just to give them a little update if there's been some changes with your loved one with dementia, just so they know and can prepare for maybe some things that may be challenging for them to see or experience, like perhaps, you know, they may not remember their name or who they are and so forth. And manage just expectations in general. So you may want to let people know and just realize and acknowledge that there are some things that your loved one with dementia can no longer do that they used to. So for example, if maybe your loved one used to lead prayer or take the lead on, you know, singing the Christmas carols or what have you, perhaps they're not really able to do that anymore. So either you know, find someone else to take the lead on it, or maybe do something else that that is enjoyable. Another useful thing to consider doing is maybe using name tags. So if someone is visiting that perhaps is not a regular visitor, it may be helpful just to have a little tag with their name. This way the person with dementia doesn't feel self-conscious and stressed out about trying to remember who everybody, you know, what everybody's name is, and perhaps get it wrong. That can sometimes cause some stress and frustration, or if they get the names wrong or so forth and so forth. So just having a little name tag may be just a simple way to avoid that feeling of being uncomfortable. And again, don't forget to let visiting family and guests know in advance if their loved one may not remember them. So that can be a difficult thing to experience if they are not aware of that in advance. And that may come with some perhaps emotions or a reaction that may be a little bit unexpected and may cause either the person with dementia or others to feel uncomfortable. So sometimes just preparing your guests for what to expect is helpful. People with dementia may also have worsening evening confusion, and we call this sundowning. And that generally happens, obviously, sometime in the late afternoon when the sun goes down. So consider celebrating earlier in the day and maybe ending the gathering sometime before the evening confusion generally sets in. And there's usually a pattern to this. So generally, caregivers do know approximately when the sundowning will start. So making plans for that and kind of working around that is often helpful. And don't hesitate to change plans or end things early if needed. So sometimes patients with dementia have behavioral disturbances which can happen randomly. So it may not always happen at the time of sundowning as expected. It can happen really any time. So if you need to perhaps end a gathering early or adjust it otherwise, maybe move it somewhere else or so forth, don't hesitate to do that. Try to be flexible and adjust to the situation and to your needs and to the needs of your loved one with dementia. And Dr. Gittleman already mentioned this, but this is important, so I'll kind of echo this point that alcohol can not only lead to depression, but can interfere with medications and also increase the risk for falls. So absolutely, this is something I recommend to avoid, and if it's not something that we can avoid, at least limit limit as much as you can. So sometimes it's possible to substitute perhaps, let's say, red wine for another red drink like grape juice or cranberry juice or something like that, or non-alcoholic beverages that are similar. Same thing with overindulgence in rich or sugary foods. Like was mentioned, can worsen behavioral issues. So certainly one of the don'ts is trying to avoid not only the change in the person's regular diet and routine, but really just avoiding sugary rich foods that often do worsen behavioral symptoms. And something that we always remind and encourage is hydration. And that's really for everyone, not just for persons with dementia. Especially in the winter, we are not as thirsty as we usually are, and we often forget when we're busy to drink water and stay hydrated. And sometimes, especially eating certain foods or drinking certain things, we get dehydrated and we forget to replenish the water. So remember to stay hydrated. People with dementia also may forget to turn off the oven, stove, or the water, or they may wander outside of the home when no one is watching. Especially if you have a gathering and people are coming in and out, and maybe others may not be so mindful, and maybe leave the door open. So just keep an extra eye on where your person or loved one with dementia is, because often they may forget which things are dangerous and unsafe, especially in an unfamiliar kind of environment where there's new people and maybe some unfamiliar things that may really trigger increased confusion. So some of the do's are to really simplify the home, avoid clutter, especially in walkways, which may increase risk for falls. Try to secure holiday decorations so they don't fall or catch fire, such as Christmas trees, menorahs, and lights. Again, don't leave the door unlocked. Try to leave anything flammable. Don't leave anything flammable unattended. Try to use perhaps electric lights as opposed to regular candles or something that might catch on fire. And don't forget to check your, whether it's smoke detectors or carbon monoxide detectors. Obviously, once a year, holiday time may be a good time just to have a routine for checking those things. And then, again, it's helpful just to remember that people with dementia may have trouble following COVID precautions and are at higher risk of complications if they get sick. So we do recommend to, again, like we always talk about, washing and sanitizing hands and surfaces frequently, wearing masks when possible, keeping a safe distance. But in general, cases are going up. So we're really recommending, if possible, to celebrate while physically distancing and utilizing perhaps technology to do virtual gatherings and connect with people over, whether it's video chats or phone calls, whether it's maybe sending digital greetings or messages. That may be safer than actual in-person gatherings. Another thing that may be fun and just something to consider is maybe doing a holiday parade. So you can ask your friends and relatives maybe to drive by with some kind of handmade signs or things to, just say hello, exchange greetings and wishes from a distance, and that may keep everyone safer. And try not to attend or plan large gatherings. And of course, if you or your loved one is not feeling well or not feeling themselves, or may have been exposed to COVID, certainly try to not come in contact with others to prevent exposure. One other don't is planning buffet or family style meals. So maybe just planning individualized meals, so there's not as much sharing of and exposure in case anyone is sick. And isolation, Dr. Gittleman mentioned this, and I just want to mention that again briefly because this is so important. Of course, it's necessary and recommended to keep a social distance, but isolating yourself too much also can be dangerous. So we really have to find a balance between being safe and avoiding exposure, and still socializing and staying connected and being active. And I think we are a little bit past our time. I'm sorry, Dr. Gittleman, I didn't leave much time for your activity. But thank you everyone for
no worries, that was great.
Thank you so much, Dr. Gieniusz.
We'll be happy to take any questions.
So if anyone has questions, feel free to just drop them in the chat. Maybe I'll open with a question that's in our current times right now. We've seen the pictures of people visiting loved ones in assisted care facilities kind of between the glass. And so there's been a longer timeline in the frequency of seeing loved ones that are having this cognitive decline. So maybe any tips about dealing with that, and also, the guilt that family members might be suffering from, because while it's, it's just the world we live in.
Yeah, so that's a very challenging thing. First of all, there are depending on the facility, some of them actually do allow limited visitations, and perhaps with some precautions like getting coronavirus testing before a visit and having a schedule kind of thing. So when possible, I would definitely recommend to use that option. But aside from that, it's not as good as in-person visits, but virtual gatherings with your loved one, whether it's in a nursing home or assisted living, is better than nothing. And sometimes it's really just a matter of maybe
Right now, I can't do anything. I'm on Zoom here, Randy.
speaking with the staff and maybe sending some things that your loved one may enjoy, whether it's a favorite food or asking the staff to play their favorite music, any kind of connection and anything that they can enjoy. There are still some things that you can do even while being physically away to make their holiday enjoyable.
And I would just add to that in terms of that guilt piece, because I know that's kind of something that I'm pretty sensitive to, because we know that guilt and shame can kind of be paralyzing emotions and can really kind of drown us. And so while it's natural to feel, I think a great tool to use in this is kind of the combination of that serenity prayer. This is something that you do not have control over. If you did, then you would probably be there more and able to see your loved one more. And so kind of accepting that which we do not have control over. And also really shifting the expectations, kind of speaking to what Dr. Gieniusz was saying, which is, shifting the bar. So if what you used to think of as a good show of care and love was having visits every other day with your loved one at their institution, that shifting that bar based on the limitations that society has created and accepting that given those limitations, this is now the best effort. And I think the other concept is one of, speaking of effort, trying to celebrate effort and intention as opposed to just outcome, I think is a really helpful way of thinking about things, that sometimes we make the effort and you have the visit, and in that moment, the person that you're visiting, your loved one, is having a bad day, or they're really disconnected, or they're frustrated or agitated. And it could end up becoming this vicious cycle where now there's even more guilt because you start interpreting that as meaning that that's their anger towards you for not going. And when the reality is you could go every day and it could be just as likely that that would happen. And so trying to give yourself some credit for the intention and the effort you put forth, as opposed to trying to evaluate exactly how the interaction went and determining your success based on that, I think is a helpful strategy to use.
Thank you. I think that's a wonderful way to frame it around the effort and intention. I know we're at time, but there is one more question in the chat. This to cannot diagnosis.
Sorry, do you mind repeating the question? I heard.
I didn't hear
repeat
it.
it because I think Kelly's audio is a little shifted, but I'll repeat it. It says, what do you suggest to do with a resistance family who can't accept the diagnosis?
So,
sorry, go ahead.
No, that's okay. I'll let you add anything, but I was going to say, I think psychoeducation, and education is probably the best tool that we have to try to combat resistance. But I also think some degree of, and I don't know if you're talking about as a care provider working with a family that doesn't accept it, or a family member with other family members that are not accepting it. I don't know if you want to clarify that, but I think in either case, I think there is sometimes psychoeducation can be helpful and involving outsiders, so clinical and professionals, to maybe help in the understanding and providing tools to that person, reading materials so that they could take in the information as they're ready to. But I also think some degree of acceptance that this is a very difficult pill to swallow. And so people might come to terms with it at varying stages. And so whatever stage they're at, to try to meet them at that stage with the focus on safety and well-being at the forefront. So if they're not ready to accept the full degree of this diagnosis, but they're willing to take certain steps to ensure the safety of that person, for instance, putting certain safeguards in the home or shifting to having more structured routine, then you could focus on trying to shift behavior as that person maybe takes their time to digest the diagnosis.
Dr. Gittleman, they actually did clarify. They were
Okay.
asking about family member to family member.
Okay. So, you know, I don't know that it would change all that much. And with, you know, still the focus being, you know, if it's a family member that it's going to take some caregiving responsibility or going to be part of that person's life, I think, again, accepting that they might need to digest that at a different time frame than somebody else, and really just trying to focus on how can you maximize the visits in a way, in concrete ways, where you give that person some things that might be helpful in managing that person, however they understand why they need to take those steps. If you can focus on those steps, it might be a helpful way to approach it.
Yeah, that's exactly right. And, you know, just again, as long as safety is not an issue, I think sometimes just patience and giving them time to accept it when they're ready to accept it is really the way to go. Sometimes hearing things from someone else is helpful. So sometimes we, for example, patients that we see in our office, there are perhaps some family members that may not really understand fully the cognitive impairment, the safety risks, and so forth, when they discuss it just between family, but perhaps involving that person in their visit with the physician or with someone else, just to kind of explain what we find and why, you know, how do we support the diagnosis itself. Sometimes it's helpful to hear and break through that barrier of whether it's denial or just not understanding what's happening.
Great. I don't know, can you hear me okay now, everybody?
Yes.
Okay. So thank you very much. We're at time, but doctors, would you potentially be able to share your materials with the
Sure.
organization? There was some queries for that. And Dr. Gittleman, you can share your exercise via email as
Sure.
well.
Absolutely. Happy to.
So thank you, everyone. Any other closing remarks?
Yeah, I just wanted to say thank you, because this presentation was really, really valuable. And I think there is just so much to talk about. I mean, I think there could be a part 2 to it. I think that's, you know, a lot of families could benefit, you know, from this webinar. So I just want to say thanks. Thank you to both the physicians. Thank you to Kelly. And, you know, we really appreciated your time today.
Thanks
Wonderful.
so much.
Thank you, everyone.
Thank you, everyone. Happy holidays. Stay safe and
Thank you very
snow
much.
especially.
Happy holidays.
Happy holidays.
Happy holidays.
Thank
Take care.
you.